Are you curious about Gestalt language processing? You are not alone. Join me, Corinne Smoose, and speech therapy PD for our podcast, The Gestalt Get Together. Our episodes try to balance the enthusiasm and excitement about GLP and its associated intervention ideas, as well as a healthy dose of skepticism about how to understand and integrate this paradigm shift into your career and the field at large. We hope that you can get together with us to learn more about Gestalts.
Welcome to SLP Learning Series, a podcast series presented by SpeechTherapyPD.com. The SLP Learning Series explores various topics of speech-language pathology. Each season dives deeper into a topic with a different host and guests who are leaders in the field. Some topics include stuttering, AAC, sports concussion, teletherapy, ethics, and more. Each episode has an accompanying audio course on SpeechTherapyPD.com and is available for 0.1 ASHA CEUs. Now, come along with us as we look closer into the many topics of speech-language pathology.
Welcome again to the podcast mini-series, Culturally Speeching, presented by SpeechTherapyPD.com. Thank you so much for joining us for our third episode, Cultural Humility Through Diversity and Equity. And we are going to have a great chat today. An overview of our learning objectives. By the end of this chat, you will be able to understand the principles of cultural humility and its significance in promoting diversity and equity in clinical practices. To be able to identify strategies, right, to implement cultural humility and in those interactions that you have with diverse populations. And finally, just to be able to recognize the impact that cultural humility can have on achieving equitable treatment outcomes in clinical settings. Now, this episode is offered for 0.1 ASHA CEUs. I am your host, Dr. Treasure Williams-Wood. I am a speech-language pathologist and clinical research consultant. I own my own consulting firm in the South Side of Chicago. Now, here are the financial and non-financial disclosures. I, Dr. Treasure Williams-Wood, am the host of this podcast and receive compensation from SpeechTherapyPD.com. And I am also a CEO and owner of my own company for which I receive a salary, as well as Lingraphica. My non-financial disclosures are that I serve as member at large in speech-language pathology on the American Speech and Hearing Association, ASHA, Board of Directors. I am so excited to welcome Dr. Valerie Borum, and she is going to be such a treat for us this evening. I told her earlier that I don't think I've ever been so excited to read someone's bio. And so she is joining us from Toronto, Canada, where she currently serves as the director of the School of Social Work at Toronto Metropolitan University. And she has been in that capacity since January 2020. So I'm sure you have a story to tell if you joined a university in January 2020 as the social work director. That could probably be a whole nother episode. As a social work practitioner, she directed not one, but two programs supervising social work and human service professionals, serving persons with intersecting identities like disability, race, ethnicity, gender, deafness. Dr. Borum's research and scholarship focus on the role of ethnoculture as a protective and promotive factor in health, mental health, and disabilities, with attention to populations of African descent. She studies the intersection of disabilities, deafness, and ethnocultural, with attention to Black African American and Afro-Latinx, Black Hispanic families with deaf and hard of hearing children. Music to our ears, right? She also studies the intersection of whiteness and anti-Blackness, anti-Black racism. She incorporates womanist and Afrocentric approaches in her research, scholarship, and educational pedagogy. Dr. Borum completed her postdoctoral studies at the University of Chester, New York. She received her PhD in social work from Howard University School of Social Work, and she received the Esther Otley Fellowship, a one-year dean's internship for one female student who most exemplifies qualities of leadership and humanity while at Howard. Dr. Borum received her Master's of Social Work from Gallaudet University, and all of her instruction was in American Sign Language, as we SLPs know. She received her BA in psychology with minors in biology and philosophy from Mundelein Women's College at Loyola University in Chicago. Her unwavering commitment to her research is evident in her role as a research collaborator and consultant with Laurent Clark National Deaf Education Research Center at Gallaudet in Washington, D.C. The study focuses on the advocacy efforts among families of color with deaf and hard of hearing children and their advocacy efforts related to their children's educational, linguistic, social, and cultural needs and aspirations. She actively seeks external funding for her research, and she was born and raised in Chicago, Illinois, where I am coming to you from right now. Her personal journey has deeply influenced her research and academic pursuits. Dr. Borum does receive an honorarium for speech therapy. Metropolitan University has no non-financial disclosures. And so with that, I'm going to take a deep breath because that was a mouthful, but it does not even do you justice. Welcome, 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 Dr. Valerie. Thank you for joining.
Thank you so much. I should add that actually I've stepped down as director. I am going to be on sabbatical for 1 year to focus on my research and my scholarship.
Focus on all of that research that I just, oh, congratulations. It sounds like a sabbatical that is well earned, right?
Yeah, long time coming.
Well, I am so excited to have you. I know we've talked a lot, and if those of you who are coming back, and if you're coming back for another episode, drop that in the chat. I love to see people who are coming back for another one. You know, we're pretty informal. I like to call these fireside chats, but we do delve into some pretty meaty topics. And so one question I always like to ask guests is, give us a definition of cultural humility and explain how it differs from cultural competence in the context of diversity and equity.
Okay, I think I'll start with cultural competence, since that was sort of like a framework that was featured prior to cultural humility. Mm-hmm. And like a general definition, what you'll find in the literature is cultural competence is a means of attending to clients' culturally diverse backgrounds, providing person-centered care, and reducing health disparities. Now, Glenn Guyton, 2024, defines cultural competence as understanding, communicating with, and effectively interacting with people across cultures. It encompasses being aware of one's own worldview, developing positive attitudes towards cultural differences, and gaining knowledge of different cultural practices and worldviews. Cultural competency then is not just about acquiring the knowledge, it's about applying this knowledge and applying it and understanding it in real world interactions, which can foster an inclusive and respectful environment. Now, cultural humility, on the other hand, is a lifelong process of self-reflection and self-critique. It requires us to acknowledge our own biases and the limitations of our knowledge about other cultures. It's about maintaining an interpersonal stance that is other-oriented in relation to aspects of cultural identity. So while cultural competence focuses on acquiring skills and knowledge and its systematic implementation, cultural humility emphasizes the importance of reflecting on one's beliefs and cultural identities.
Love that. I love that. And so what would you say, in your experience, are the core principles of cultural humility?
I would say that basically it's about self-reflection, self-critique, because those are important for understanding one's own biases and limitations. I would actually critique even these definitions if I could, if I may.
No, but
Is it okay if
you-
I like to critique those definitions?
Yes, yes,
Know that
please do.
they're standard definitions, and this is what we're working from. And like I said, I gave definitions that in the literature that are actually as of 2024, as of today.
Yeah, yeah.
And I always say, okay, what is missing? And what's missing from these definitions is an interrogation of whiteness
Mm,
and hegemony.
I don't even know what hegemony means. Hold on, you gotta break it down for us.
Domination.
Okay, I like that. That's gonna be my word of the week. So,
And what it does is it sets up BIPOC communities, Black, Indigenous, and people of color, as somehow or another the others,
mm,
right? And so these communities are then otherized.
yeah,
And they're scrutinized. And they're scrutinized in almost a manner as if trying to understand these cultures, it becomes a burden of knowing,
yeah, yeah,
right? Or what it even means to be American. Somehow or another, we are outside of what it means to be American. And we know that what it means to be American is somehow or another simultaneously associated with being white. And we
yeah,
know that what is simultaneously being associated with being white is also being human.
yeah,
So while we're talking about cultural competence, or while we're talking about cultural humility, we're not talking about why these groups are on the outside. Why are these groups minoritized? How is it that these groups are otherized,
yeah,
right? And how is it that whiteness becomes the standard for which all other groups are somehow or another understood as being outside of their full humanity,
yeah,
right? And so when we understand like how groups are otherized, we have to bring in history. What happened that these groups are now considered others? And so BIPOC groups are otherized basically as a result of oppression,
yeah,
marginalization, racism, colonial structures, such as education, housing, healthcare, the criminal justice system, et cetera. And so Gordon Pond talks about how, and Summer Colt, they both speak about how cultural competence at one point became sort of the new racism.
really. Okay,
Yeah.
because in our field, right, in speech pathology, when we studied, it was like you need to be culturally competent. And it was almost like and it's still to some degree, it's like a box to check. And I'm sure that's probably not unique to the field of speech pathology. I'm sure in social work it's very similar. So how did it go from being this thing that was this bad negative thing to now being this thing that is the box to check, the peak of the mountaintop to get to in clinical work?
Because there's an assumption that BIPOC groups, in terms of how do we address disparities, because if we're saying disparities are based in cultural competence, in some ways, it's almost like we're saying that my culture is what places me at risk.
Mm,
But my culture doesn't place me at risk. What places me or my culture and my people at risk is, again, racism, colonialism, marginalized, otherizing people who are somehow or another considered different because we keep using whiteness as the standard.
right.
And I think when we talk about communicating across cultures, I was just about to sign, communicating
Please do.
across
We look,
cultures.
as there's an SLP, you are welcome to sign everything.
Because I'm working with the research team and I'm working with deaf researchers, and it's just like it's a worldview
It's a
switch. I have
code,
to get back.
switching. Yeah,
Yeah,
exactly.
I have to get back to, so yeah. And so it's see, when we talk about like it's like communicating across cultures, but one is not really able to communicate across culture unless one understands one's own culture.
Mm-hmm.
Right? And so what it is that we have whiteness, which is a culture, a Euro-Western, Eurocentric sort of Anglo kind of cultural worldview that dominates and that's institutionalized. It's
Mm-hmm.
institutionalized in such a way that it becomes unrecognizable,
It
right?
just
It just
the
considered the
norm.
norm.
It's just the norm. And
It's
so
the
it's not,
norm,
there's an option, it's considered the standard.
the standard.
Mm-hmm.
And so you have many whites who cannot be culturally competent because they don't have any attachment or knowledge of their own culture, because whiteness is hidden and we need to make it visible. And I think we need for BIPOC people to understand some of the elements, the deep structures
Mm-hmm.
of Eurocentric sort of ideas and worldviews, so that not only that we understand who we are, but we understand who they are. But what's interesting is Sartwell, he speaks about, and he's a white philosopher, and he says, race consciousness is basically forced on, for example, African Americans. He says,
Right.
we just won't let you forget that you're Black.
Frederick Douglass talked about that, right? That secondary consciousness. And I'm sure most non-white folks or, who identify as anything differently will say that there's you, and then there's the consciousness of your otherism, whether it be BIPOC, whether it be across the gender spectrum, whether it be anything different, that's that second consciousness, and you carry that with you wherever you go. It's almost like your twin. And yeah, and you don't realize that there's a whole culture of people who don't have that. But I've read, yes, Frederick
Well,
Douglass.
see, that's so interesting. There's a whole culture, because, he says that because we basically, our culture is presented as neutral, as the standard, and is basically hidden even from them. He says that whites are the last group to become conscious on their own. They can
Yeah.
only become conscious in a situation in which Blacks become conscious about their race, thus giving them sort of instruction to understand even who they are themselves. So,
Yeah.
cultural competence and cultural humility, I mean, I can be culturally sensitive,
Yeah.
but is that going to really reduce the disparities?
No. Right. And how does that lack of understanding, because one thing I've learned, and I'm sure you've learned this as a social work practitioner, is that you do have to, if you're not a self-actualized human, it is so difficult or if you're not on that in terms of, and I saw this, and I'm sure you see this in graduate teaching, when you're training practitioners, and Bell Hooks talks about this, right? Like education as the act of freedom, and how you have to be on a path to self-actualization and understanding your culture and who you are in order to provide services for others. So I'd love to hear about some of your experiences, because you did, you are, social work practitioner, how you've been able to grapple with that.
To grapple with
Learning, self-actualizing as a woman of color, learning your culture as it relates to whiteness, as it relates to being in a system that is set up, unfortunately, to oppress, right? While also providing these services.
It's when I was getting my PhD and my dissertation, I focused on African American, Afro-Latina, Black, Hispanic families of deaf and hard of hearing children, because I got my master's from Gallaudet, and all of the literature basically was focused on white families, white hearing families with deaf and hard of hearing children, or white deaf families with deaf children. And there was nothing pretty much in my education that helped me to, understand the differences, because, I kept thinking, wait a second, all of this is so white. And so that's what sort of led me to do the research. and this was like one of the first studies to actually look at African American hearing families with
Yeah.
hard of hearing children. And I used frameworks that pulled me in and centered me in culture, in history, in heritage, Afrocentricity, womanism.
Mm-hmm.
And so those frameworks allowed me to sort of like span the deep structures of culture and worldview. And it just is, for example, like in Eurocentric ways of knowing in terms of epistemology, like how do you come to know what you know? And
Right.
it's through counting and measuring.
Mm-hmm.
Numbers are meaningful. So you're deaf based on the decibel loss, right? What
Right.
your dB loss is. And within African American families, it's not based on, it's an affective way of knowing. It's the oral tradition is important. So how do families say whether someone is like fully deaf or hard of hearing? It's not by your dB loss. It's about how and when you use your voice.
Oh,
So if you use your voice, then you're considered hard of hearing, even though your dB loss may be profound.
wow. I never knew that.
Right? Because of the heritage, the African heritage, and the importance of the oral tradition. And within the field of deafness, it's not quite understood why African Americans still rely on the oral tradition.
Yeah.
And part of that is that, African Americans, and I say African Americans because I'm African American, but also because of the unique experiences of African Americans, where through enslavement, segregation, Jim Crow, that African Americans have been able to retain
Right.
much of the African tradition. So what folks don't realize is that all of these barriers to so-called integration actually helped to somehow solidify some of the African heritage that you see in African Americans today. And how do I sort of use this knowledge in working with, say, African American families, hearing families, and their deaf children in a school setting? Having to explain the importance of why African American deaf children are still using their voices and why that is so important, because just because African American children are deaf, that doesn't mean they're no longer culturally African American and that they don't grow up in African American communities.
Right. And
Um,
that's
yeah,
just, you just made such a valid point that makes me think about the field of speech pathology. My training is in the hospitals, right? I've worked across the lifespan, but really a lot in the hospitals. And one thing we see, right, we also treat swallowing, right, dysphagia. And I've seen so many times in skilled nursing facilities or rehab hospital, an elderly Black person has a stroke, they're hospitalized, they're put on a modified diet. And for some reason, that means they stop being Black. They just feed them food that they've never eaten their entire life. They evaluate them based on their ability to sustain nutrition and hydration. And then everything is measured not by their true ability, but really by, are you able to eat these foods? And, I've gone through this with my grandmother before, who was hospitalized with dementia, who would not eat anything until we came and brought her soul food, until we brought her yams or plantains and our ethnic cultural food. Before then, they wanted to give her a feeding tube, right? Because she can't, but to your point, just because she's now a patient doesn't mean she stopped being Black, right? Doesn't mean she stopped being an African American, and doesn't mean she divested from her culture. So
right.
what are some some practical strategies that you think clinicians can use to implement this type of awareness and humility when they interact with with diverse populations?
One of the most difficult ways of knowing in the United States is its resistance to understanding history. Many don't understand history. Many, history, culture, language are not something that are necessarily even valued or understood in the United States. But I think that in order to work with people, just not so much who are different from me, because if we're talking about, oh, these are people who are different from me, we're really talking about people who are different from so-called the standard of whiteness.
Yeah.
We have to interrogate that first and foremost. But I think understanding history, how did we get to this point? How do we get to the point of like, well, we need to understand cultural differences. We need to understand different ways of knowing, different ways of being, and different ways of doing. And how did I get to this point where I am within a particular culture? How do I understand myself in the context of culture? How do I understand? See, because again, when we understand culture, for example, within a very Eurocentric worldview, differences usually are correlated with deficiencies, with pathology. And that's because of the worldview, because the worldview is based in binary logic, right? It's either or. Everything is sort of dichotomized. Either you're black or you're white. And so when you're in between, it's like there's not even a language to really describe the nuances of that gray area.
Sure.
And see, this is what's institutionalized. You're male or female. And if I say, like, for example, I think I'm beautiful. Oh, what do you think? Somebody else is not beautiful? I never said that.
Yep.
But if you're coming from a worldview that is based in binary logic, of course, it's either or.
Yeah.
You can't, and see, and from an Afrocentric or an African-American cultural worldview, it's both and.
Yeah. That's true. But you know, what's interesting is that don't you think the academy prepares us in that way? When you look
Oh,
back,
definitely.
right? When you look back to our training, I think about our training as speech language pathologists. I mean, we probably had a thin hair of a bandwidth to think outside of anything. And so now you have, you know, we had to do that and think like that in order to survive. And then then we're at this point and we're thinking this isn't fit. And how do we go from?
Right. And that's why when I speak about my PhD, I had psychological freedom. Because if I had to focus on a research study using positivistic sort of measures and to try to quantify what we have not been able to qualify, I would have come out mentally challenged.
Yeah, but that's a lot of our practitioners. And I think social work is the same way, right? Because you practice
Yes.
social work with a master's, right? And so I'm not sure about social work, but for PhDs, it's very hard to get someone to go back and get their PhD because there's not a big difference in pay. And then some people, you know, they're deterred from practicing sometimes, and it can be really complicated. And so then the question is that you got your master's degree, that's what you got, and you want to be a great practitioner, but now you're in it. You're in the trenches, you're in the field, right? And you're putting together, like you said, this new world view, but also having to quickly turn around and apply it. And I'm looking to the chat because I'm not sure if I'm just like shouting into the void, but I'm wondering if anybody can relate to that who's actively practicing and trying to improve their cultural awareness and their introspection. So if you do, please.
There needs to be a paradigm shift, even from the time we start this educational process, right? Because it's not going to be, we're not going to have an impact if I'm being taught to somehow or another be white. If I am being taught, if there's a colonial script where the outcome is assimilation, right? And then that's when they're considered success. Eradicated your culture and your understanding, your ways of knowing and being and doing, which is actually a form of cultural genocide.
Mm-hmm.
And then expect that we're going to all just somehow or another become white and respond to whatever is considered appropriate culturally for that white mindset and that white way of being.
Yeah.
Because other than that, I'm considered problematic.
Mm-hmm.
Right.
Yeah.
And so Like I said, when I was in the master's program, I kept thinking this does not relate to me or to African Americans. It was just,
Yeah.
but that's the training. You graduate with an MSW. But yeah, I mean, being able to just center yourself and your people,
Yeah.
there's so much freedom in there. There's so much liberation. And then you have like an armor almost
Yeah.
to really protect you against these like otherizing. Like if I didn't have this worldview, I would not be able to critique this kind of information.
Commitment
Because
to that is really important. And so I think this is so important to talk about, because I think as a practitioner, we always want to jump to the doing. We want to jump to the doing a lot. And so this is really, I love this. This is definitely a word for me, right? Because I, even I do research, I have a doctorate, but at my heart, I'm a practitioner. And I'm like, okay, so what am I gonna do with that? What am I going to do with that? Wait, how can I take that to the bank and cash it? How can I make that into something? But what you're challenging us to do is to shift our worldview.
yes.
And go inside and really challenge some of these worldviews and take a path of introspection, which I think means being comfortable with being uncomfortable.
Yes. It's like I have this is actually a Jewish woman who wrote, and You're the Boss.
And I also want to encourage everyone to share how your reactions as well as your questions, because sometimes I know some of the things we have will not be questions. Oh, that's wonderful.
It's much better, right?
Yeah, it's much better.
Well, you don't have to get the book. I'll try to actually give you the copy, because what I use of this is just when it talks about white culture and it's making whiteness visible. It's and when she says in terms of white culture, because this was written in, gosh, this was, what year was it? I mean, this was like in the 80s, 85 or something, but still is relevant. She says, we believe in rugged individualism. The individual is the primary unit. So when we're talking about cultural competency and cultural humility, we're talking about the individual.
Yeah, ourselves, right? We're centering ourselves. Even though we're giving patient-centered care, we're still centering ourselves in that patient-centered care, right?
Exactly. And when we focus on the individual, guess what we leave out? The systems in which these individuals operate.
Yeah.
Right?
Right.
Because much of what is experienced by BIPOC communities, it's not necessarily just on an individual level.
It's not
systemic.
interpersonal. It's not
It's
interpersonal.
systemic.
And that's why no matter how many unconscious bias trainings you take people to as practitioners, it's not going to eradicate systemic racism, right?
Exactly. But if we're focusing on the individual, guess what? We don't have to talk about the systems. We don't have to talk about power.
Yeah.
Right? We don't have to talk about domination.
Right.
We don't have to even talk about whiteness. Right? And we believe in the Protestant work ethic. Hard work brings success. I remember Barack Obama once said something, we were made for work or something. That's a worldview.
Yeah.
That my 9 to 5 or how many hours I put in, that somehow or another, what we say constitutes work. And it's like, we are competitive. We strive to be number one. Winning is everything. Keep that in mind. This competition, particularly when you're talking about within institutions, you got to compete with one another. How do you then have an environment that is conducive to healing and to different ways of being, knowing, and doing if everybody's competing with each other?
One of the things, I mean, I don't know if it's like this in social work, our profession is so incredibly competitive. Is it like that in social work?
Yes.
Where we would have to, I was a director of clinical education at a graduate program, and we would have to get them all in a room and say, okay, everyone, the competition is over. You've all gotten into graduate school. You're all here. And even then, there was this competitiveness that had just been ingrained in them. And I remember feeling it too. But like you said, we're not connecting that behavior is going to taint and also be influencing your clinical practice. For some reason, we started compartmentalizing that so early that, and I'm reflecting on myself as you're saying this. I'm thinking, wow, that competitiveness doesn't just go away, right? You don't take off your grad student hat and then put on you're the same person. Yeah.
Right. And when you think about it also in terms of competition, if you think of it in terms of groups, in terms of how we're looking at power, this hierarchy has what? Who's situated on top?
Yeah. Somebody's
So,
got to be.
yeah. And so whites want to concede, they want to continue to see themselves on top. Remember, we're talking about white culture here, where it's extremely competitive. So there's difficulty in saying, okay, well, this person or this group is supposed to be at the bottom, but yet they're outdoing me in something else.
Yeah.
Right. And so it becomes that competitive in terms of even when we look at race and culture, there's competition there as well. And I think what's also interesting is that, let's see, what we emphasize the scientific method. That's the only way that you can know. They assume it's objective, but it's also subjective.
That's huge too in our profession, right? We are taught, right? When you do an assessment, scientific method, what do you think is wrong? Well, what are your investigating? What's the variable? How are you measuring? And that is the measuring stick. So this is
Yeah. And then this is also, we believe in cause and effect, the dualisms, either or, mind, body, good, bad, right, wrong, it's all of this. But they also believe in that their system, they say that they believe that not only the Christian system, but their ways of being and their white system as superior to other cultural systems. Our ideology is to bring other groups up to our standards. That's important to know. Because see, this is what we're dealing with.
Yeah.
Right? The way we're framing cultural humility and cultural competency, it's somehow or another, these other groups are problematic because they have not yet, risen to our standard yet. So now we have to do this extra work.
Having trouble, right? Right, exactly. And we talk about that a lot, right? That, I use the example, why isn't diversity and equity and inclusion treated like infection control in a hospital? In a hospital, it's like 5 opportunities to wash your hands here. It's just a standard to always wash your hands. It's incorporated, it's measured. But then when it comes to diversity, equity, and inclusion, it's this extra thing like, oh yeah, and if you're really good at DEI, right? Could you imagine if you went to a hospital or you were in an environment where you were receiving medical care and they were like, and they happen to also do hand hygiene here. You would go, ill. What do you mean they happen to also do it? But we accept that for diversity and inclusion. Like, oh, they also happen to do some good DEI stuff here too, where it's not standard because it's really like, well, and those other people tend to have problems. So if you could also have a translator at your eval, then you're really good versus the bare minimum, right?
Right. And see, the contagion is racism. Why aren't we treating it like that?
Yeah. Oh, I want to call your attention to Maria says, having the language to communicate what we felt and known for a lifetime, but was always considered problematic is crucial. I agree with you. I wonder how ASL may be changing with these conversations, including the unique experiences of the deaf community in the conversation and allowing their voices to be heard requires some cultural humility from the hearing community and understanding or hearing their stories.
Well, see, that's so interesting because I lived and I was immersed in the deaf community for 3 years. And somehow or another, I intuitively knew that it took at least 3 years anthropologically to really immerse in a community. And, it was the deaf community, the hearing community. And I was just like, there is no hearing community. I'm not, part of a community because we're not deaf. I mean,
yeah, that's interesting.
We come from different communities, whether we're hearing or deaf. And the assumption that all deaf people are the same because they're deaf. Once again, it's what is considered deaf and what the knowledge base and so forth is white deaf.
Yeah.
It's white culture, but with deafness as that component.
I
And
never even thought about that. I never thought about that.
exactly, it's all white. And this is what, because like African American deaf children or deaf students at Gallaudet University, I mean, it's getting a little better, but 75% of African American deaf students would withdraw within the first semester because of blatant racism, blatant anti-Black racism. So the assumption that we're all alike, we're all the same because we're deaf, is once again, it's erasing people's histories. You get folks, deaf people from all over the world. They don't stop being African American or Latino or Asian. And
Right.
even within those groups, you get a lot of diversity. We can't erase that and focus on deafness. And part of the problem with how we understand cultural competency and how we understand cultural period, is that we keep comparing what I call synchronic factors, for example, like age, gender, deafness, disability, class, and so forth. We keep associating that with race and ethnicity and culture. And so that deafness becomes the culture, and guess what is now invisible? Whiteness.
Yeah.
Even American Sign Language, there's an international sign language which the United States refuses to acknowledge. So everyone who comes to the United States or go to Gallaudet, they have to learn ASL, American Sign Language, which is based actually on the French Gallaudet.
Yeah.
And so that forms a base. It's very European, it's very white. There's actually a Black sign language. It's actually a language.
Wow, I didn't know that. Wow.
And so this is why it's so, I find so dangerous when we leave out components of what it means to be human.
Mm-hmm.
History, heritage, and focus on, because like, for example, so many times I say to white women, you come from a culture. Being a woman is not the same as being African American ethnically. Because you have an ethnicity, you have a culture.
Yeah, it's not the same. Yeah.
But
And I think, why do you think we oversimplify these things?
binary logic, either or.
Binary logic.
Hearing deaf, like there's a hearing culture. Really? Really? You get African Americans who rely on the oral tradition.
Yeah.
And then you have Europeans who rely much more on somehow or another what is written.
Right.
Right? If it's not in writing, it doesn't exist.
Yeah, that's true. That's true. And
see, it's because we're all taught to use this framework of binary logic.
so how do we push back? And this is a big question, right? How do
By
we push back
introducing
against
different worldviews and centering these different worldviews, not as others, but guess what? As the majority population. Nearly what? Like less than 20% of the world's population consists of people of European descent.
20%? Yeah.
Less than 20.
Yeah. And it
The
takes
world-
courage to do that, right? Especially in this climate, I found that, and I'm not sure if you relate to this, but it takes courage to be a practitioner that is willing to center other worldviews in such a time as this, where everything is so binary, where everything is so either you love people or you hate people. If you explore this, then you're trying to destroy children. If you explore that, you hate Christmas. If you explore that, then you hate, the Easter Bunny, right? It takes a lot of courage to be able to do that as a practitioner, while also trying to navigate clinical competence, right? Because we've talked about cultural competence, but then there's that clinical, what makes you clinically competent. And as a teacher and as a student, I'm sure you've gone through this too, being Black, being of other, and going through a white institution, clinical competence to me was always code for be as closely proximal to whiteness as you can as you do this profession, or
Right.
you are not going to make it.
Right. That's the message, and it's loud and clear, and it's institutionalized, and that's the expected outcome. But humility allows us to sort of decenter the white worldview. Oh, I'm sorry, that was from Jordan? Oh,
That was from what?
I just saw the last chat. Someone put in the chat.
Oh, okay.
But yes, I mean, for example, like I have, in working with African American hearing families and their deaf children, for example, within a school setting, and it was the model school for deaf children.
Mhm.
And, you know, as a social worker, and I was a counselor as well, I would work with families having what we would call psychoeducational kind of, you know, groups.
Uh-huh.
And I would work with African American hearing families as well as Latino hearing families, and I would basically give them the 411. Like, okay, if your child comes in with a bruise, because it's in a school setting that children are most likely to be reported for child abuse in terms of the families. If your child comes in with a bruise, as a social worker, as a counselor, we are mandated to report it.
Right.
Okay, so this is what we're going to have to do. And like, especially when I'm working with African American families, because I know, you know, it's like you spare the rod, you spoil the child.
Yeah.
I get it. I understand it biblically. But here's what we need to do. You know, you don't want to hit your child or discipline your child, corporally discipline your child, first of all, when you're angry.
Yeah.
You need to count, take a break. And if you can't do it, have someone else in the family, if you have an older adult in the family who can do it. But calm down first. Do not hit your child with an object. Yeah, I know you can take off that shoe.
Right. I know. We all know.
You know, if you need to use corporal punishment, you know, that's what the butt is for. Make sure that the clothes, that there's clothing so that your child is not walking in with a bruise.
Yeah, because
So relax.
that's seen as something much, much different. That's a siren, right? Yeah.
Yeah. But you see how I'm trying to work? I'm starting with where the families are.
Is not,
And I'm not
you're a
saying
bad parent if you
you're a
if
bad
you your
parent, you're
children,
abusive, we should remove your children and put them in child welfare. You know, I'm not saying
getting
any of
them to
that.
stop and think.
Like, stop and think. This, when you're in this environment, okay, when your child is in this environment, this is what's going to happen. This is what's real. So how do we navigate your desire to continue with corporal punishment? And this is not about, oh, there's some families that don't believe in corporal punishment. Well, that's fine. You know, if you got the privilege, you know, that's fine. You know, but, you know, these parents are trying to socialize their children, you know, in a way that they have to take on, you know, hostile environments.
Mm-hmm.
And so I'm working with families being culturally sensitive and culturally, you know, in terms of humility, saying, I'm going to start with where you are. I'm not going
And
to
that's
come in.
tough because you have to decenter yourself or your views.
Yes.
You're not sitting here
Yes.
saying, I would ever hit my, right? You might never,
Yes.
ever spank your child, or you might not ever have anything to do with that. You might think, oh my goodness, but you're not centering yourself in your worldview in that moment, right? Because most people would clutch their pearls. I would never hit a child. Why would you ever hit a child? I would never do that to my child. But you have no idea what it means to be the descendants of slaves, to be, you know, and I talk about this as a Black woman, right? You know, Black people didn't get free from slavery and just go to therapy and, you know, get through it. It is, and in many cultures, it's that idea that, well, we were beaten in order, I have to beat you before the police beat you or before the streets beat you. And that's a cultural thing that you're not going to unpack during one school year when you just happen to be that one teacher in that one classroom or that one practitioner working with that family. And so you have to decenter yourself, which takes a lot. right?
Right.
Because it may not be in an alignment with how you may be raising your children or your culture's parenting skills. But again, to your point, if you're centering a worldview that is standard, that's going to be very hard.
Yeah. I mean, it's like, as a social worker, I'm sure people are saying that doesn't sound like a social worker. But no, that's cultural humility.
Right?
Being
Because
able to start with where the client is
yeah,
and working with them to navigate in such a way that it is very supportive of their aspirations, their beliefs, their values, but yet saying we are within this system
yeah.
is oppressive. So how do we counteract that in
And
ways
it's
that
also a
are
power
positive?
issue, right? Of empowering parents to stop and asking them to reflect, but not feeling like you're stripping them of their power to where they
Right,
feel even more small and fragile so that they are abusing their power, right? Then you're turning around and creating the very thing that you were trying to prevent.
right. Because I'm acknowledging and recognizing and respecting that they are the parents,
Yeah.
and that they are the ones who are facilitating this family structure and preparing their children for a world that, I mean, we're talking about also children who are deaf and Black,
Yeah.
where is, if you're out there and you're doing something, well, folks are not going to know that you're deaf until you use your, sign language. They're seeing a Black child.
So for them, the stakes are a lot higher.
Yes.
And a lot
Yeah.
of people, we had, when I was a clinic director, we had similar issues like that with children in the clinic. I mean, we used to have a parent that would come, and if their children were highly autistic, and if they did anything wrong, in my opinion, and in most of the people's opinion, right, that the parent would really react very strongly, snatch them up, no, and you're in your mind, you're thinking, whoa, like this is an issue, does have to react. But the parent made a comment like that. I have to make sure because the world is not going to see this person and think, oh, hey, you have to meet them in a place where they think you care, right? Because if people don't think you care, they won't care what you think.
Right,
And I
right,
think it
right,
speaks to that. I think sometimes as
right,
practitioners, when working with diverse populations, we slip into power struggles with parents. We slip into power struggles with family members. We slip into power struggles with the people that we are serving because we know best, because we know
right,
the
right,
standard.
right,
And instead of stopping and thinking, okay, how can I decenter my worldview and center their worldview? I'm not dying, I'm not giving up my values, but I'm decentering myself because if I truly want to serve these people, I cannot serve them if I am robbing them of their sense of power in their own family.
right. Exactly. Exactly. Because that's very dehumanizing.
Yeah.
And another strategy that we could use, I always say, is real simple. Let's ask clients how they could be better served.
What
What
would
are
you,
their aspirations? Because I always, when I work with, whether it's families, individuals, work with communities, I always want to start off with where they are. I want to start with where they are, and I want to know what their goals and what their aspirations are.
yeah.
What are their hopes?
Yeah. Oh, I
What
love
are
that.
their challenges?
That motivational interviewing. What does better look like for you? And I think
Yes,
we've gotten a lot better in our profession using
yes,
patient-reported outcome measures and more subjective qualitative, but we need more of that, right? What does better feel like for you? What does it look like for you? And
right,
how will you know you're better? I
right.
love that. And we have 2 minutes because I know we can talk. This is
Oh, okay.
so many nuggets, so many mind blows. I feel like I just needed to go in my thinking chair and think after talking to you. But uh, do you have anything that you recommend? I always ask people, what are you reading? What do you have any authors that you're like, oh, if I really recommend this person, any text or literature that you recommend that we delve into, those of us who are interested in exploring?
Yes. What I can do is let's see. What I can do is I'd like to share with you an article that I published. It's it's seminal. So see, because I think a lot of times we want to read like what's happening now, and that's important. But there's seminal work that laid the groundwork
Love
that
it.
I think is also just as important. But I do want to share with you, like I did one publication, it's a journal article, and I delve into culture. What does culture means? What does it look like?
Perfect.
And I use an Afrocentric approach in working with African American families. And I also even have a section on looking at language and
Okay.
how language is also tied to worldview. And because it's tied to worldview, it's tied to the linguistic structure and the grammar, and that it's also a philosophy that influences how we think. So when you
So what
hear,
I'll do, Dr. Borum, because we have 1 minute,
okay,
I will take that, and I love this. I'm going to put that on my Instagram.
okay,
That we are going to also put it, hold on, let me see. So I'm going to drop my Instagram in there. Follow me on Instagram. I will put the link to Dr. Borum's article in there. And I see, Tammy, you have your hand up. Please throw your question in the chat for me. Thank you so much. I'll put the article on Instagram, and we'll also put it in the reference page on the podcast website so that we can get it, because I know we do have a hard stop right at 8. I
okay.
want to thank you so much, Dr. Valerie Borum, for just blowing our minds. I think I have a whole list of words that I have to go to my dictionary, and they're going to be
Oh,
my
I'm so sorry.
no, I love that. I love that. I words that I'm just going to start using in my daily vocabulary. We just appreciate your research, your education, and the expertise that you've provided about.
Did I answer the question of that?
Am I looking at questions am I missing? I don't have any new questions.
Oh, okay.
The question I only have, I only have last one from Maria.
Oh,
And then my email is also provided. So if someone has questions, they
okay.
can also email us a follow-up. But thank you so much for this expertise about diversity and equity and cultural worldview. I think it's been so valuable. And thank you all for coming and attending episode 3. Okay, and
May I
so,
say something real quickly? I know
yeah,
you're on out of time.
yeah,
When you spoke about inclusion, there was this, I don't know, someone posted it on LinkedIn, and they said inclusion isn't just inviting someone to sit at your table, it's believing they belong there.
yeah,
I found that very problematic, because I said, what about believing that the table belongs to us all?
right. Right, instead of the meritocracy, right? Oh
Yeah.
God. We might need to come back and talk about meritocracy, because that might be a double hour. We need 2 hours.
Thank you so much for having me, and thank you for this, opportunity to really like to
Oh,
interrogate
I
and
love this. This was good. This was so good, because we are not, I know she's gonna put on the music in a minute. I'm surprised she hasn't put the Sandman music on me yet, but we're not challenged to have these kinds of conversations in our profession. But then we're criticized for not having the tools. And so it's really, and I'm sure most healthcare professions are like that, right?
Well, yeah, I mean, I think of my time at Gallaudet University, where they were going to have, I think it was an audiologist, someone come and speak, and the students, barricaded, because audiology is such a bad word for particularly, see, it's a bad
Mm.
word for white deaf.
Yeah, yeah, yeah. Oh, it's not like that with other cultures, other deaf cultures,
Like I
audiology.
said, like African Americans, they
Yeah.
want the speech, they want the voice.
Really? I didn't know that. And yeah. And I remember in school studying audiology, and that was a big thing, that they do not like SLPs, but then you never stop to ask who is they. It was like deaf people, capital D, deaf. But did that necessarily mean all cultures of deaf people?
See, capital big D deaf is usually deaf children from deaf families, and deafness is much more likely to run in white families than, because if you talk about, once again, health disparities, deafness, like among many different groups, is a result of some other issues like
Right,
poverty,
right.
childbirth, and all of these other issues.
Right.
Um,
Maria says a shift in thinking here. I know, me too, Maria. Me too, right? It's not all about us. Who knew, right? Not all about us.
We have to be aware of that it's not all about us and why it's not all about us.
Right. Thank you. Thank you.
Thank you
Thank
so
you.
much for having me.
You're welcome. Thank you all.
Thank you for joining us for today's course. To complete the course, you must log into your account and complete the quiz and the survey. If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete mailing address in your account profile prior to course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to reflect on your ASHA transcript. Please note that if this information is missing, we cannot submit to ASHA on your behalf. Thanks again for joining us. We hope to see you next time. Each episode comes with an accompanying audio course on speechtherapypd.com, available for a 0.1 ASHA CEU. And just for our listeners, get $20 off any subscription with promo code SLPLearn20. Speechtherapypd.com is run by SLPs for SLPs. They've got the largest library of ASHA CE eligible courses out there, and they're adding fresh content every week. Remember, use the code SLPLearn20 to get $20 off access to over 1,000 courses for an entire year. Head over to speechtherapypd.com for more information and start earning CEs today. Thanks for tuning in to the SLP Learning Series. And don't forget, speechtherapypd.com is your go-to for all things ASHA CEUs. Your positive reviews and support mean the world to us, and we'd love for you to drop us a quick review and hit that subscribe button.